Also at the State House today, a bill that would require all public water companies to include fluoride in their supplies cleared a legislative hurdle. Now, environment correspondent Ed Rogers is in our Trenton newsroom with more. Ed?
That's right, Jim. The Assembly Health Committee released that legislation today. The bill's sponsor wants to reduce tooth decay and improve oral health, but there's opposition. The bill is sponsored by Assembly Health Committee Chairman Herb Conaway, who is a physician. He says New Jersey ranks 47 out of 50 states in providing fluoride in drinking water.
Poor dental health, which impacts the ability of a child to learn, which causes missed days in school, which leads to unnecessary pain and suffering, is something that we can do something about at very low cost, and we should move forward right away, in my view.
But environmentalists oppose the measure, saying the fluoride additive that would most likely be used contains arsenic, mercury, and other harmful metals.
It is not an essential nutrient. It works best when topically applied to the teeth. We do not need to eat it. We simply have to put it on our teeth for the protection.
Conaway says many segments of the state's population who can't afford over-the-counter fluoride treatments suffer from poor dental health.
Some 60% of the country has fluoride either in their water by way of nature, or it's been added. And if those concerns are there over 60 years, it seems to me we ought to know about it, and we might have done something to stop it.
Water companies also have reservations about the plan. They would like to see more study before a fluoride mandate is enacted.
Whenever you have an additive with water, it may not be proper for all water supplies, and we're concerned that with the overall use of fluoride in water supplies, that with the public, a very small percentage actually get used for cosmetic purposes.
Often, though, it's not the government, but consumers, especially parents, who make the final call on what additives go into our food and water. Carolyn Fisher of Rocky Hill opposes a mandate and says using fluoride should be a personal choice.
I think that there's been enough studies done that fluoride can damage your health, is detrimental to your health, and I don't know enough about why they want to put it in.
Other moms say they would rather have the option.
I guess I prefer no fluoride in the water, and I'll give them fluoride drops if they need it. So that way I know what they're getting.
Now, about 8 states require fluoride in their public water systems, but residents in 6 other states have turned down efforts to include the additive. It looks like new EPA Administrator Lisa Jackson is weighing in with New Jersey when it comes to tightening controls on mercury pollution. Jackson says the EPA will end its legal fight against efforts to reduce mercury emissions. Last year, 17 states won a federal appeals court ruling that said EPA's mercury rules were too lax. Under the Bush administration, the agency had been preparing to appeal to the U.S. Supreme Court. And one other environmental story to report, a Superior Court judge has upheld New Jersey's claim seeking damages from ExxonMobil for harm to the environment and natural resources caused by operations at 2 of the company's refineries. Jim?
All right, thank you, Ed.